Hello, welcome to my presentation. Today I'll be discussing a research article titled Ethical Work Climate, Moral Courage, Moral Distress, and Organizational Citizenship Behavior Among Nurses. Throughout the video, I'm going to be referencing the factor organizational citizenship behavior as OCB as quoted in the article. That's a long word, so they just shorten it to OCB. So from now on, that when I say OCB, that's what I'm talking about. Anyways, this article is written by Abdeen and Atia. I believe that's how you pronounce their name. During this video, I'll explain the goals of the study, provide some background of the article, talk about why the research was important, walk you through the methods, share the results, and then wrap it up with a discussion and conclusion with recommendations by the author. And by the end, you'll understand what the researchers found and why it pertains to nursing practice and patient care. The main goal of this research article was to explore how four important factors interact within the nursing practice. The first being ethical work climate, basically on how ethical the workplace environment feels to the staff. Two, moral courage, the ability of nurses' ability to stand up for what's right, even when it's difficult. Moral distress, which being the stress that occurs when nurses know what the right thing is to do, but can't act on it because of institutional or professional barriers. The last one being OCB, which is the voluntary extra behaviors nurses do that aren't required, but improve the workplace by helping coworkers or supporting the organization. They use these to be able to see how the ethical climate of the hospital influences nurses, their courage, their stress, and willingness to go beyond the basic job duties. On why this matters, previous studies show that the ethical climate of a workplace directly impacts the nurse's job, their satisfaction, commitment, and turnover rate of the institution. When the climate is positive, nurses feel supported and are more productive. When the climate is negative, it leads to stress, burnout, and potentially leaving the profession. The three key concepts are moral courage, moral distress, and OCB. Moral courage is essential in nursing. Imagine a nurse who notices a patient isn't being treated fairly or sees a medication error about to happen. Speaking up may be difficult, but moral courage helps the nurse advocate for the patient's best interest. Moral distress is going to be something that happens when nurses want to do the right thing but can't. For example, a nurse might know a patient needs more care, but hospital policy or physician's order may prevent it. The conflict being called, or the conflict between these values and actions can be exhausting for a nurse to witness. OCB is all about teamwork and going beyond the basics. When the nurses help each other out or volunteer to help with extra tasks, or even show their loyalty to their workplace without being rewarded for it. These behaviors improve efficiency and patient outcomes. Given how important these factors are, the researchers wanted to know, how do they connect? Does a positive ethical climate boost courage in OCB? Does it reduce stress? And that's basically what this study explores. This study was necessary for a few reasons. Each of the topics have been studied individually, but very few studies have been looked at for all four of them combined. Secondly, most research on these issues came from Western countries. There was a lack of evidence from Egyptian hospitals, which faced their own unique challenges. And this study occurred in Egypt, so we'll be able to see more research done over there. Finally, understanding these relationships are crucial because nursing shortages and a high turnover rate is a problem globally. If improving ethical climate can reduce distress and increase commitment, that knowledge can guide nurse managers, leaders, to create a better work environment. Now, how the study was done, they used a descriptive correlational design, which means they weren't testing a new treatment, but instead looking at the relationship between two variables. This occurred at Zagazig University Hospitals in Egypt, which includes 8 teaching hospitals. A total of 384 staff nurses participated. They were chosen through random sampling. Each of the nurses had at least 1 year of experience. 4 standardized scales were used. The Hospital Ethical Climate Scale to measure the ethical climate, Professional Moral Courage Scale to measure the courage, Moral Distress Scale to measure the distress, and the OCB scale to measure the extra role behaviors. The tools were translated into Arabic and reviewed by experts. The reliability was strong, with scores ranging from 0.81 to 9.6 using the Cronbach scale. I believe that's how you say it. The data was gathered over 3 months from May to July of 2019. Nurses filled out self-administered questionnaires that took about 20 to 30 minutes. A pilot study with 10% of sample was done first to ensure clarity. The data was analyzed using the SPSS version 21, and that basically focuses on descriptive statistics and Pearson correlations to see how the variables were related. Now, the results were that the average nurse was about 35 years old, 70% of them being female. 79% of them were married, and about 2/3 had less than 10 years of experience. The actual findings were that 89% of nurses perceived a positive ethical climate. 85 of them reported high moral courage. 83% reported high moral distress, and almost half, being 48%, reported moderate OCB behavior. This correlates, being ethical climate was positively related to both moral courage and OCB. This means that when the climate was better, nurses were braver and more willing to go above and beyond. Ethical climate was negatively related to moral distress. So the better the climate, the less distress the nurses felt. And lastly, moral distress was negatively related to both courage and OCB. In other words, when the distress went up, the courage and efforts went down. So these findings mean that the ethical environment of a hospital is a critical factor. If the nurses feel supported in doing the right thing, they have more courage and contribute more to the organization. However, the study also revealed that nurses reported both high moral courage and high moral distress. This suggests that even though nurses are willing to do the right thing, they often face barriers that prevent them from acting, such as managers, hierarchies, institutional constraints, such. Organizational citizenship behavior, OCB, was only moderate, meaning that many nurses may not feel encouraged or supported to go above and beyond the minimum requirements. These findings are consistent with some international studies, like those conducted in Turkey and Iran, but they also show differences compared to the Western countries where moral distress levels may have been lower. In conclusion, the study highlights that ethical climate strongly shapes nurses and their experiences and behaviors. A supportive ethical climate leads to more courage, less distress, and stronger OCB. The researchers recommend that the nurse leaders and administrators 1. Promote and protect positive ethical climate. 2. Provide ongoing ethic education and training. 3. Create policies that reduce barriers and distress for nurses. Encourage moral courage by recognizing and supporting ethical actions. And finally, conduct further research on ethical leadership and long-term outcome interventions. This article directly affects how nurses feel, how they act, and ultimately how patients are cared for. Thank you for listening.